Yeah, thank you very much for joining this session also and listening to us and asking us questions. We had a very good first session, looking now forward to the second session. My name is Jannis. I'm a co-founder and the acting CEO of Postdoc. And then if you could go to the next slide already, please. Just a big background about myself and how I ended up where I am now. So I was born in Berlin, partially raised, but also partially raised close to Hanover, and then came back to Berlin in 2007 to start my bachelor in physics. And subconsciously, I always had in mind, I guess, to also become an inventor. Daniel Düsentrieb is a big role model for me in that sense, or used to be. And so I thought physics was a good basis for that, because it's quite versatile and you can do a lot of things with it. And so I started at Freie Universität 2007 to 2010. And after the first 4 semesters, I decided to also see something else, and I did an exchange semester not too far away, but at a different university in Zurich at ETH, Polytechnic Institute there. And this was actually the step that brought me very close to what I do now, because this was, when I was there, I found that particle physics was very interesting, very fascinating. And I went to a professor and said, look, I found it really fascinating. I always wanted to go to CERN. I have no clue what they do there, but I want to learn. And can I do my bachelor thesis with you? And the answer was a simple and plain yes. And that's how I went into particle physics and continued at doing the masters, which I did at Humboldt University, that also has that subject. And I also spent during my masters a year at the University of California in Los Angeles. Which gave me other insights, other courses, other aspects how a university can run, and also professors that can teach you, in that case. And then I went back, finished my master's at Humboldt University and BSE-Zeuthen, which is the German particle physics lab. And then I went back to ETH and CERN to do my PhD. Wasn't particle physics, but very applied. I worked on a project developing a positron emission tomography system for research for small animals, meaning mice and rats. Who knows what a positron emission tomography system is? One person. So for all the others, but I keep it short, it's basically a functional imaging method. You inject this very slightly radioactive material that quickly decays into the body. Can be, for example, glucose, but also can be other things you can make visible with that, and then you can measure body function. Glucose consumption, a lot of glucose consumption happens in tumors. If you have damaged tissue, there's reduced glucose consumption. And there are other also tracers, for example, in Alzheimer's disease, where you can image amyloids, which is one of the things that aggregates in your brain, which you can now remove with new drugs, which were approved last year in the US and coming to Europe soon. And now I already gave away what we do in Postdoc, because 2 years into that project, this idea came to us and they said, the doctors we're working with will have Alzheimer's medication in the next couple of years. And if we do, we need to make positron emission tomography much more available and affordable, and we need a dedicated brain PET system. And this is what we then started. First, it's a university project, 3 years postdocs with grants, building a first lab prototype, looking nowhere near like that, more like how you would imagine a Daniel Düsentrieb-like physics laboratory PET scanner. And but it worked. We scanned 10 patients for them, and this was the basis for Postdoc, the company I now have and that we founded together, that has made this prototype in the past 4 years. Now a medical device, as you see it here. Here it's in the University Hospital in Leipzig. Ready to take first patients. We actually did that. Very good quality, comparable performance to the state of the art. The FDA clearance, which is the US authority, is pending in the next 2 to 4 weeks. And then we're ready to give it to doctors to then serve the patients better. And that's my story.